Good evening, dear colleagues. I welcome you all to this interactive session between the Mrtb officials and uh, registrants of the MRT. Thank you so much for finding time to join. We have had many inquiries sent through different channels, social media, phone calls, and we thought it's important for us to interact with registrants. There have been a lot of releases from the beginning of the year until now. But it's still important to have these interactions just to see if there are some clarifications that need to be made, especially with regards to licensing. And this is coming at the time, a peak period, end of the year, where everyone is trying to renew their license. So I welcome you. And I think instead of speaking, this is a forum that we want to provide to listening. And therefore, I'm not going to go into speeches or dishing out information. I think the best thing is for us to listen to you. And we'll have people raise their virtual hand. They'll be given the opportunity to speak to us. We'll listen. And then at some point, if there is need for us to respond to issues, clarify issues, we'll do that. Where we get advices that we need to consider as we move forward, we'll do that. We only have about 26 people online, but I think because everyone has left work, coming back home to rest, I think we shouldn't wait, especially because of the fact that it's about the interactions. We'll continue to interact while as people join. They can also interact with us and let us know what their concerns are and what are the things that we need to do at Mrtb to make things better for our registrants. So thank you so much, everyone, for joining. Please, I would like to get feedback if you can hear me well. I'm using an earpiece. It's possible that I may need to remove it if you can't hear me very well, because yesterday we had a workshop and most participants had me more when I removed the earpiece. So just give me a feedback if you can hear me, and if there is any other thing that you want to make as a comment before we start taking the, I can hear you well, wonderful, that's great, that's fantastic, okay, so that's good. Okay, so if there are any, yes, we can hear you, and very well, wonderful, that's great. So anyone that has any comments or questions, as I've said, we came here to listen, not to bore you with speeches and information. Feel free to raise your virtual hands. We'll allow you to speak, and then maybe we'll take few. Then after that, we'll respond. So you're all welcome. Anyone with any comments or questions, feel free to raise your virtual hand. Okay, I can see Sally Abiso. Yes, you can unmute and speak.
Good afternoon, sir.
Afternoon.
Thank you for giving us this opportunity to speak with you. Actually, I have some questions regarding the license renewal. Hello? Can you hear me, sir?
Yes, I can hear you now. You can start afresh. A call came in and disrupted the network, but you can go ahead. I can hear you now.
Oh, okay, sir. Afternoon. Thank you for giving us the opportunity to speak with you. My name is Salih Habiso, sir. So we just finished my internship in University of Mrtb Teaching Hospital, October 2023. And then I've submitted with some of my colleagues our license renewal for 2025, and it happens we've gotten license valid for only 3 months. That is from October to December. And we have to renew it for us to enable us to do our NYSC. And we are unable to get a slot to get into the NYSC during the recently just concluded batch C. And next batch will be January, and we have to renew our license. And we don't have any CPD to do the renewal for the license. So I don't know, sir, what is our stand? Thank you.
Yes, sorry, Sally. I think I only heard that you did your internship in Maiduguri and you want to go for internship. What's the problem? Your internet was possibly, the network was bad. I didn't get the whole thing. Oh, come on. Hello, Sally, can you hear me? Hello? Okay, I don't know whether I can't hear you at all, but I didn't really get your question. Just Sally, are you still there?
Yes, sir.
Okay. So let me
Hello, am I audible?
who is the please, the admin should please take responsibility for muting people. Yes. Okay, Sally, go ahead. Okay,
Hello,
go
sir.
ahead.
I don't know if I'm audible.
Yes, I can hear you now.
Okay, sir. Okay, sir. We completed our internship recently in October 2023,
Yes.
and we applied for a license renewal from provisional to professional license.
Abinda 8:15 za a fara.
And then it happens we've gotten a license for valid only for 3 months. That is from October to December. And we are starting our NYSC January 2025. So I don't know how are we going with the license renewal, considering the fact we don't have CPD and it's a prerequisite for us to get into the camp. Thank you, sir.
Okay. I think because the rule of the board is that if you are renewing for this year, even if it is 4 months to the end of the year, that renewal covers you for that year only. So you can renew in 2024, and then it lasts for the end of 2025. So that's the rule in the board. That's the regulation. I've had a lot of inquiries about that, a lot of pleas that we should allow it to extend beyond the year that corpus renew to get into the year after that. But it's something that we can't just take a decision now because these are decisions of governing board. We don't even have a governing board on ground at the moment. And therefore, these are things that we can consider to make a submission to have it reviewed. But until that, then we'll have to go with the regulations at the moment. So what you need to do is to renew for 2025. And some of your concerns have been addressed. The issues of CPD, I said you have a lot of responsibilities. You can't be able to pay for CPDs. We said we'll do them for free. I was with Chijioke in the afternoon here in my office, and we discussed. I was telling him, let's quickly arrange to have these workshops so that you can be able to renew your license before the end of the year. If there are any other challenges that you think we can come to your aid that are not regulatory issues, please feel free to always reach out to us. But whatever it is that has been approved as a regulation in the board, we can't change that just like that. We have to go through the protocols of the bureaucracies of changing such regulations. Thank you. Yes, next is Vincent. Yes, Vincent, please unmute and speak. Yes, Vincent. Okay, Vincent, go ahead.
Okay, good evening, sir.
Yes, good evening.
Yes, sir. Thank you, sir. I'm a physiotherapist over about 2 years practice experience post NYC, sir. Sir, my concern, sir, is I would say specifically, it seems as though that's my perception, as though most of the directives from the board are meeting us impromptu, especially with regards to license renewal. I remember last year, sir, so I said most of the directives regarding license renewal,
yes,
from the board, they are meeting us impromptu.
Okay.
Yes, sir. So I remember last year, when I wanted to renew for the year 2024, we were told that that for the subsequent year, that will be 2025, that license renewal has to be done December, and not only that, that there is a specific amount of CPD points that have to be gotten before licenses can be renewed. And okay, that's that. So, but recently I got some information, although I can't really validate those information. I got them from colleagues saying we need a minimum of 45 CPD points of varying categories now, regarding to, I can't remember vividly now, but regarding to, I think, professional development, management and all that, which is something that I consider very, very impromptu. The last I know was that we were told, okay, we have to renew, we have to make sure that license renewal happens December of the preceding year. And also, there's another information that the deadline for the license renewal is 15th of December. I can't tell how factual those informations are, but can you make clarifications what the what's it called now? What the directives are, and if perhaps they have been impromptu. I mean, if the directives are impromptu, and what can be done for those of us that are caught off guard. Thank you, sir.
Okay. Thank you very much. I think this information about changing the deadline to end of December and also the issue of the CPDs that should be across domains was released last year, before the end of last year. So there were many people that reached out saying it's just be released instead of starting last year, end of December, that you must renew your license. And we did that deliberately, released it so that at least people will be aware. And if people ask, we said, well, we'll extend it. And we extended it till this end of the first quarter or end of March, just like it used to be. But we continue to make a release. We continue to have stakeholders meeting just like we are having now. And we kept telling people that by next year, that is 2024, if you want to renew for 2025, it must be end of December. Any renewal of license that gets into the new year, then it is from 1st January, the fine will begin to apply. So that has been released for a long time. I remember the issue of the CPD, we said we increased it to 60. And we gave the breakdown for the practice, leadership and management, research, and professionalism. We gave that since last year. And in 2024, early to mid 2024, there was a lot of commotion. People were complaining bitterly that having to do 60 across those domains was going to be very challenging, especially because at that time, the economic crisis was on and people complained bitterly. And one of the posts that took our attention was when someone said, look, you can keep insisting people must have 60. Many people may not even listen to the lectures. They will just join, and at the end of the day, they will get their certificate and they will renew the license. They don't want to do workshops. And that was what piqued our attention to say, well, what we are doing to enforce having to do workshops is so that people can improve their practice. But if that's not going to happen, let's reverse it. We reversed it to 30. And when we increased the years to 2, and that also came through suggestions at that time that there was discourse on the issue of license. Why don't you have it for 2 years? We also had a plan to have it for 2 years. We had a discussion with the minister. He also was disposed to having a license for 2 years. We got the approval of the minister. But instead of saying, let's start with the 2 years immediately, we said we are going to run the license renewal for 2 years and maintain what we had, the 1 year. And that's why we didn't even give information about it, because that's what traditionally we have been doing for many years. Anyone that had renewed their license renewed for 1 year, paying 20,000 if they are 10 years and above, or 13,000 below 10 years, and also CPD 30. That's what everyone has been doing. So we said, but for those that want 2 years, they can start from now. 2 years, you pay 1.5 instead of doubling it. Because for 1 year is 20,000 for 10 and above years. Instead of saying pay 40,000 for 2 years, we said, okay, pay 20,000 and then add only half. And that's what makes it 30. We released that also. So you are paying 30. The same thing with CPD. Instead of paying 60 CPD units for 2 years, we said pay 30 for the 1 year and add half of it for the second year. And we released that. We kept releasing that. We had interactive sessions. I remembered we had physically in the board hybrid. Many people came to the board and many people joined through virtually. We released this information on our websites. We released it on all social media handles, WhatsApps and Facebook and what have you. And many people were aware. But of course, there are people that were not aware at that time. It was recently that I asked that all the database that we have, unfortunately, for a very long time, the database at the board, they are on paper. They are not captured electronically. And I got a team, said we will pay them, let them put all the emails and all the phone numbers. And that's what we intend to continue to do. And I remember when we were calling people individually, I asked them in the office, since at that time it was not electronic, it would not be easy. About 6,000 phone numbers and emails that you just now put them on electronically and begin to send emails and text messages. What I did was to ask them to use those numbers and call. They called almost every single person whose phone number is captured on the register that we have. I know people that reached out to me to say that they were called and they were given information. But all in all, we need to do more in the aspect of reaching out to registrars. I must admit that. I wouldn't be giving excuses. There are reasons why things have happened, but I wouldn't be giving excuses. I'm just going to say that we are going to improve when it comes to the aspect of reaching out to participants. We can do more, we can do better, I believe. But this is the information, and I know from last year, we have been releasing information. And just to let you know, for you to even know that people are aware, it was when it comes towards the end of the year, and we are Nigerians, this is our attitude and mindset. We cannot have the information, but it is when it comes to a week or two to deadline, or even a few days to deadline, that people now will begin to take action on many of such matters. Now, why did we say 15th of December? If you want to be in the bulletin, if you pay beyond 15th of December, you will not pay fine in as much as you pay before the 31st. Unless if you don't have CPD, even if you pay by 15th, and you have not supplied all that's required to be in the application for license renewal. If you get to 31st and you don't have everything, on the 1st, you submit your CPD, you must pay fine. But if you pay by 15th, or you pay by 16th, or you pay by 19th, in as much as you have all your package ready before the 31st, or before the 1st of the new year, you will not pay any fine. Now, why did we say you pay by 15th? There are two main reasons. Number one, we say in your license that the license is valid from the 1st of January to the 31st of December of the following year. Now, if you make payment on the 31st, it takes our department few days to process the license. And therefore, if you think payment means renewal of license, payment is not renewal of license. Payment just means that you have started the application process. Someone needs to sit down and look your payment and say, yes, you are right. The last time you renewed was 2024. And therefore, the next one is 2025. And therefore, 20,000 that you have paid for 1 year is valid. Then look at your CPD. How much CPD do you need? You need 30. Oh, he has 25. No, he has to go and complete 5. Someone needs to process. And when they complete processing from the department, they will bring it to the registrar's office, and then a signature will be given on the certificate. And it is at that point that you say license has been renewed. So if you pay on the 31st, and we are going to process it for a week or two, meaning first week of January and second week of January, you'll be practicing, you don't have a license because it has not been processed. So you might look at this as too stringent, too conservative, but the law is the law. If you can't practice unless you have a license, then you can't have a week or two in the new year without a license because it's been processed, it has not been issued. And this is why we said pay by 15th. Another reason, which is good for you, is that at the end of the year, remitter usually is too busy. And many people have reached out to us to say that, see, we can't make payment. They are running helter-skelter, they can't make payment. Of course, you can't make payment. Why? Because everyone is trying to make payment at the same time. It's not just Mrtb. Every organization, we want to also make payments so that the money will not be mopped up. And if you pay by the end of the year, 30th or 31st, there's no way Mrtb can use it. And what do we use the money for? We use it for the services that are required. We'll buy the computers, we'll buy the cards for the license. That was when we were using cards. We'll buy letterhead paper for those that are requesting for letters of request, and so many things. You pay on the 31st. If you are able to pay, network may not allow you to pay, or the busy nature of the platform may not allow you to pay. And then we also will have difficulty. So there are so many reasons. Well, so look, bring it back, 15th. If you pay after the 15th, it's still okay. but you may not be able to get your name get into the register because after 31st, we'll close all license processing and focus on those that paid up to 31st or up to 15th. Within that 15 days, we'll continue to process. We are not going to look at any payment. But the moment we finish, we'll print out the register and we'll now send it to all the places of work, hospitals, universities, and all other places. Let them look at it and see their staff, whether they are up to date with their registration or not. So these are the reasons why we took the decisions that we took. But as I've said, we are having discussions. Whatever is not within the regulations, we wouldn't mind listening and adjusting. We have adjusted a number of things just to make things easy and life easier for our registrants. So these are just few responses with regards to that. Yes, thank you so much for that. Then I think we have. Yes, next is Ziki. I saw Glory earlier. Okay, Glory is still there, but we are not then the next one that I have on there. So maybe, okay, Glory, go ahead because I saw your hand earlier. Unmute, please, and speak.
Thank you so much, sir. Good evening, sir. I'm so happy for Mrtb putting this together. It's really enlightening. It's a progress from what we've experienced earlier. Straight to the point. I'm Glory. I'm currently a core member. I'm going to pass out by January. Sometime last month, I packaged my application, all my requirements, that is my payments, my ID card, which has been the custom for a very long time. I packaged my payments, my ID card, my past license, that's my old license for 2024, and I mailed it. And suddenly, I think some weeks ago, I was now here. I've been hearing something about that we need CPD. The thing is, I didn't know that. I've not heard that corpus needs CPD because the custom has always been you either identify using your ID card or your discharge certificate. And I've had colleagues that did theirs earlier, even in this year, go through that and got their license. I think their license from last year. So it's very worrisome. I just need you to clarify these issues because I think so many people have different ideas as to what the requirements for corpus should be or what it is. So I need clarifications on this. Thank you so much, sir. I don't have CPD. I really don't have CPD. And I mean, this is the end of the year. It's really troubling. Thank you so much, sir.
Thanks a lot. Number one, let me say, what's the principle behind insisting that people must have CPD to practice? The principle is that for you to practice to be a professional, you need to continue to update yourself. Evidence-based practice. When we were in school, what we were taught, the moment you finish school, 1 year, 2 years, you will come and see researches that have shown that what we were taught in school, now they are better, more efficient, more valid tools or interventions to treat patients. So even what we were taught in school, sometimes we forget things. And that is why they say 50% is pass mark. And I keep asking, if 50% is pass mark, what happens to the remaining 50%? So meaning you know 50% or you remember 50%. What happens to the remaining 50%? And that is why you see regulatory bodies saying you must do CPD for those different reasons. Now, when someone completes their first degree and they go for internship, we don't ask them to do a CPD. Why? Because they are still going through training. Someone is training them, someone is teaching them, they are adding more to their knowledge and their skills. But by the time you get to the point that you finish your internship. You'll be given a full license. When you are given a full license, when you are doing an internship, there is no way you can go to any facility that does not have people that can train you, and you go there and you do an internship. Alone, you are the only medical application professional in that unit or department, and you'll be practicing. As an intern, you finish. You now come with a document to say your head of institution has cleared you, will give. It doesn't happen. In fact, we even do accreditation so that at the end of the day, we know that someone is there to be able to take care of your needs as a trainee. And therefore, by the time you come, we issue your full license. But when you get your full license, I served in Guru FMC Group. I was the only physiotherapist in FMC Group. I was the one that started the department. I was the one, and come and see now the issue of separating these domains. If as a corper, you don't learn about management. When I went there, I became a head of department. I was the one that gave the proposal for establishing a department. I was the one that gave the list of equipment that they should buy. They bought the equipment. They established the department. And that was when I was about to leave. And the moment I was about to finish, they employed someone, headed the department. I left, went for my academia. Right now, I go to Nguru, I see the department. I'm very happy, I'm very proud. But when I see what I learned now in workshops on management and leadership, I always say that how I wish I had known those things before I go to Nguru. I would have done things even better or differently. So that is the reason why it has been asked. And I'm very happy that you said custom. Said custom. There is never a regulation in Mrtb that says that corpus should not or don't have to do CPD to renew their license. You are getting full license like any other person is getting full license. You are allowed to go and practice as independently as any other person will go out there and practice, except the fact that maybe there are those that have specialized, and therefore there's going to be hierarchy in places where you have specialized people that they are going to still mentor you. Where if you find yourself alone, you can practice like any other person that can practice alone. So these are the principles. And therefore, we said now, look, should we continue with that tradition? Is it helping our registrants? If it is not, let's do the right thing. But last year, when I insisted that we should ask corpus to do CPD, the department said, look, well, it's too close to the time. I said, no problem. But by next year, we must have it. But all this, let's leave the complaint out. Let's leave all the excuses and the explanations. What is the way forward? We know the principle is good. When some of your colleagues that are doing their NYSC complain on the platform, I said, look, what's the problem? It's about money. We can't pay. I said, okay, let's organize something for free for corpus. And that is what we are doing right now. By tomorrow or next tomorrow, I know we are going to roll out the plan to have free trainings for corpus. And if you are on the platform, because Chijioke said he's going to develop open a WhatsApp platform or something like that, where you are going to discuss and give the timing that's more convenient for you. Because of work in the afternoons and mornings, and I usually prefer evening. I had 4 different workshops from Thursday, Friday, and then, Wednesday, Thursday, and Saturday, Friday. And it is because of issues like this. Some people just let me know that they have missed out on a number of CPDs. I said, don't worry, organize one, but I can only do workshops 8 to 10:30. If we do 2 days, we have 5 CPD, 2.5 hours, 2.5 hours. And that's what we did. We did research for 2 days. They got their 5 CPDs. And then we did leadership and management for 2 days, Saturdays and Sundays. Yesterday, around this time, I was doing a workshop. So we are open. It's not about anything but about people gaining the knowledge and skills that they need to advance their professions. Our professions have been left behind. We don't have postgraduate clinical programs. People can go and do masters and PhD. But when you go to work in clinics, masters and PhD have a limit to how much they can help you to be able to see patients. So we need to sacrifice. We need to be able to do these things so that we can advance our professions. If you have anything that you think you want to ask us to do to help you, we'll do that. The only limit that I have is that whatever the regulation of MRTB says, I can't change it. I can't come and ask you to pay less than 30,000 for 2 years or less than 19,500 if you are less than 10 years. I can't do that. But any other thing that has to do with money, any convenience, what time should I have the workshop? We are doing it in the night. Some people do it on Saturdays. Some people do it weekdays during the week. So please, whatever it is that you need as support, we'll give you. But that principle, we know it's important. We are not going to go back. Corpus must do CPD. And even going forward, if we are doing this, why did we say 1,500? We say workshop. Tell me, where is it in the whole world that people will do workshop? A whole day workshop at 1,500. But we did that. We said anyone less than 5 years, who are we looking at? Corpus, interns, and those that just finished their NYSC, they have not gotten a job. Pay 1,500. And how many CPDs do you need? 1,500 for a day is more than 5 hours. You have 5 CPDs for 1,500. And you don't have to do that in a month. You can spread them across the whole year. From the beginning of the year, first month, 1,500, you have gotten 5. You need 45. Do that for each month, 1,500. I think it's reasonable. And by the time we get to next year, Corpus can come to us and say, the hands-on that you are charging high, we can't pay it. I assure you, we'll arrange with people that wouldn't mind collecting little, because that is where the payment goes. You pay resource persons, you pay for feeding. The last one we had, over 10,000 per person is what we paid for feeding. The remaining 15,000 we pay for resource persons honorarium, and then venue, and for those places that we have to pay venue. At the end of the day, what comes remaining is little. What do we use that for? We buy equipment, so that in the future when we're doing hands-on, we don't need to be begging for departments to give us equipment. We have our own equipment and the board will use it. So this is the situation. As I've said, if you need support, reach out to us. We'll always support you. Thank you. Yes, I think I have Ziki. Yes, I don't know the full name, but Ziki, if you are there, I think you have been asked to unmute.
Hello, sir.
Hello, sir.
Yes.
Yes, I can hear you. Go ahead.
I think, hello, sir. Can you hear me?
Yes, I can hear you. Go ahead.
Okay, so my name is Zikrila.
Okay.
Thank you for the new development you are bringing into the MRTB Nigeria. I just have 2 questions or 2 issues to talk about. The first thing is regarding license renewal, which I think not only me, quite a lot of people are experiencing this issue. I think I applied, I sent all my documents and the payment receipt to the MRTB email, and I have been following it up. Luckily, I've been getting responses that MRTB has acknowledged my application and my receipt and everything, but I haven't had any feedback regarding to whether if my license is ready or not. I think I've been sending quite a few emails. I've been getting responses that okay, MRTB has acknowledged, but I haven't got any positive feedback as regards to availability of my license. That is number one. Secondly, issues regarding to those that are living abroad. Will their CPDs matters, and how will MRTB assess or quantify the CPD points they have gotten in the abroad? Thank you very much, sir.
Okay. Thank you. Thanks a lot. Number one, the issue of no reply to license renewal. I'm happy that at least you have gotten a reply that says it has been acknowledged. I apologize that you have not gotten a reply saying that it has been. But anyway, I don't know how long it has taken, but no matter how long it is, I think now that we have digitalized things, we should be able to do things faster. Usually the process of renewal license, when you make a submission, as I've said earlier, Someone is going to sit down and look at the payment from account, and then institute will look at the CPD. And then registration will now look at any other thing that remains as at the registration, and then they will now do a memo. And that memo will now come to registrar's office, and then it will be approved that the license will be issued. So usually this takes a few days. Of course, now that there is a lot of applications coming in, that will take a little longer than we used to have in the past. Now, if you go back in the past, you'll see that license renewal used to be a hard copy that's submitted. And when you submit, you have to go to, or you send it to a zone, and then the zone will set it to headquarters, and then it will be renewed, and then it's sent back to headquarters, and then from there, it will be sent to the registrant. And what we did was to say, let's digitalize. But digitalizing things, when you don't have the funding to be able to put in place all that you need, is difficult. So if the paper one was going smoothly, we wouldn't introduce digital license renewal just like that. We will take our time to make sure that the system is perfected before we introduce it. You don't just come with an innovation and then it works just like that. You have to test run it. But the problem was that there were a lot of complaints. The delays were serious because you have to, there's only one office in every zone. One office in every zone. And before it comes to the center, and then center complains, it sends back to zone, there were a lot of complaints. So, okay, let's digitalize it. At least the one in email is an instant thing. Prof. E.B. John developed a platform for license renewal very long time ago. So we now saw that it's there. We are not really going to start from the scratch. He gave us training and gave us training and gave us training. And at some point, we thought it's ready. We even released the link. I believe some people are using it because even today people send message to me, said that they have used it, but they got stuck at some point. I said, because it's end of year, we have not completed that process. Go quickly send through the email. And that's what we have been releasing on our information that's been released. So we are at that point that we are trying to make the digitalization work seamlessly. We are working on it. But then all this that we are trying to do got affected by this issue of no funding. From January until last week, our staff never got paid once. 11 months. Someone that is collecting 150,000, he's not been paid for 11 months. When I initially, beginning of the year, 2 months, 3 months, I started to issue query and things started to work. But later I realized someone that has not eaten and can't even pay for transport to go to work, what query will you give them? And what I did was to start now to look from our IGR to have people come in. You can't pay staff extra because they are going to be paid later. But if you bring someone from outside, you say, okay, I'll pay you 50,000, please do this job and support those that are staff. They are not getting salary. They can't come every day because they can't eat, they can't pay for. So all those things delayed us, affected our running of things. But just last week, people were paid. Myself, I've not been paid for 16 months. From the time I became registrar of Mrtb, I've never collected salary up to today. I've been assured that by the end of this month, I will get the arrears for this year, and then I will apply for the remainder of last year. But all this is just sacrificed by staff. They are doing it, and I thank them that they did what they did. Now things are going to change. When I came in today, I had meeting with about 3 people, medical attendance professionals that just completed their NYSC. We have taken them, send them 2 to registration, 1 to accreditation, but that they are also going to be falling back in registration to help them. We have landlines now that people are going to be answering calls, and we have assigned someone that's going to be answering emails at every time. I assure you, within the next few days, you are going to see changes. I want to apologize to all those that have experienced problems. What we have given as excuses are just excuses. It shouldn't stop us. But then in reality, as the head of the institution, there's a limit to which I can enforce things when someone has not been paid salary for 12 months. So, but I assure you, now that people are being paid salary, monitor us. If things don't change, then we don't have any excuse. then please continue to give us feedback so that that will continue to push us and motivate us to do the right thing so that at the end of the day, everyone is satisfied and no one is going through any troubles and hurdles to renew their license or any other activity of the board. Now, assessing CPD in diaspora. We have, in our release, we said it. We said it's not just even in the diaspora, even in Nigeria. Anyone that does CPD, because all this issue that you must apply to the board and pay and get the CPD approved, I'm not comfortable with it. I want this issue of CPD to be really very seamless, let everyone be able to do it, because we are encouraging people to go and upgrade themselves, to get knowledge, to get skills. We shouldn't limit them with bureaucracies. But everyone will just go and do anything and just bring it. And I have now as a principle in the board is that if you do your CPD with an organization that is on the database of the Mrtb, meaning Mrtb recognizes that institution or that organizer, Mrtb will accept it. It doesn't matter whether you are in Nigeria or you are abroad. We know many. It's just like universities. NUC has list of universities. When you come, they will just say, is this university recognized? Oh, yes, it's recognized by Nigeria. I remember recently they blacklisted few universities across some countries in the borders of Nigeria. And therefore, if you come, you say, oh, this is not acceptable, we'll not accept it. So the same thing Mrtb wants to do now. We are building a database and we'll continue to update it. If you come with your CPD and it is from the recognized institutions, organizers that Mrtb has indexed or has recognized, it will be accepted. But if you bring one that Mrtb is not aware of and is not recognized, even if it is abroad, because abroad is just a name. We also are abroad to other countries that are not here in our country. So if you bring one that Mrtb does not understand it, we'll say, look, we have to verify. Just like we do verification of your certificates. We'll now write to the institution and say, okay, give us information about, because if you are the one that will supply the information, many people are good people, but there are some other people that can just give you anything. We know how these things work. So we'll write to the institution, give us information about your resource persons, about the topic, about the content, about this, about that. How did you, then at the end of the day, they reply, and then we now use it. We issue a license. But of course, whenever it comes to verification, someone will be responsible, not the board. You have to pay for the verification. Up till now, we have not put a cost to it because we want to understand and know how that. But if you do it with any institution, send it through registration at mrtb.gov.ng. And now our license is not hard copy anymore. When I came in, I went to some of our zones and I saw a pile of license. I said, what's this doing? They said people don't collect them. They just ask you to scan and send to them funds, doing them and keeping them, they are not being used. I've stopped hard copies also. They just do it online. What we are doing now. So if you are in the diaspora, pay through remitter, get your CPD, you have paid complete, believe me, you. So, EB John is still having workshops, trainings for our staff. Now that they have been paid, there is no excuse to delay the process. The moment we complete it, then we'll now stop using the email. Gradually, we'll now launch the site. What you need to do is just to go up there, click on the payment, make payment using your card, and then upload your CPD. You just wait. When they finish processing and the registrar approves, they will upload your license on the site. You'll get an email that you can go and get your license online, and then you'll go and download it, and that is it. And I assure you, we'll work tirelessly until this system becomes much more seamless and much more easier to use. Thank you very much.
Thank you, sir.
So next, I think we have Dr. Adesokan.
Hello, sir.
Okay, hello, yes, go ahead.
Yeah, good evening, sir. Hello, sir. Hello.
Hello, Your Excellency, sir.
Yes, go ahead. Okay, go ahead. I can hear you.
All
Go
right.
ahead.
Good evening, sir. And thank you for organizing this meeting. First of all, sir, so that I won't take our time, I just have some little questions, and if it's some, I don't know if it is opinion, if it will count. Then, first of all, sir, the time you sent in the meeting publication, sir, was it 8:15 or 7:15, sir?
The time for this meeting?
Yes, sir.
It's 8:15.
8:15, because when I got in around 8:15, it seems.
Are you not in the
that,
UK?
Yes, because I said that would be
Okay,
7:15 to us, right? That's 7:15 to us. So most of the time, when most of us
yes,
came in.
so if you look at the, I think it says West Africa time or something like that. So it's
Yeah, so
Nigerian
when we
time,
came
not
in
UK
around
time.
that 7:15, it's like 100 people on, and it's like you've gone, you've gone far with it.
Okay.
I'm not too sure of that, but I believe we still made a lot of the meat of the occasion, not only the bony parts. So, sir, I just, like you've talked about the mandatory training and things like that. I want to ask, these are some questions that have been lingering over the years, which some people have been asking me, and we've been able to communicate to Mrtb, and some have not been rectified up to now. One is on the mandatory training and the certificate. Now, if we want to renew our license, yes, we need a CPD courses. And some people in diaspora, in wherever trust or organization they are working, they have this thing we call mandatory training, which means you must be not less than like 90% of your mandatory training, which involve a lot of CPD courses. So I want to ask, will that also surface as a CPD for renewal of license? Because that's part of limitations some people have been having in diaspora, like, where do we get CPD? These ones we've been doing, we've been paying for it. Will it serve as the CPD? Will it be accepted in Nigeria? Like you said since it's wherever it is, abroad, anywhere, it can be verified. But there are some, like the mandatory training, there are some of them that you can't print out the certificate, but you can screenshot, and any other person that is outside the trust cannot access it. So I don't know, how do we go about that? How do we want to, how do Mrtb, how they want to verify that, if that will be able to serve as CPD points? Then the other one is, for instance, you said the payment, the renewal of license is now 2 years now. So on my own case now, I've paid for this year and I've paid for next year. So I want to ask now, do I need to update with the new payment to make it 2 years, or how do I go about that to be updated, like for my license to be up to date, since it is now 2 years registration now? I only paid for next year. So now that we have new fee, new price or new fee now, am I going to pay half of the new fee to get the second year, which is 2026 now? Then also the third question is on the issue of certificate of good standing from Mrtb. A lot of people have always been having problem getting that, because who do they contact? Do we have any hotline that they can actually reach out to? Because a lot of people, when they come to me, have disturbed this Mr. Sulaiman even midnight, I'll call him. I'll even forget that the time has changed at times, you know. So I don't know. Do we have like an maybe hotline or a responsive email that somebody is mounting? Like, okay, within 24 hours, within 48 hours, you will receive response to this. And can it be downloaded on the MRTB websites now, so that, okay, when they need it anywhere, okay, do you have a letter of good standing from MRTB? Is this something we can just type your registration number on and just bring it up and you just download it, like the way they just do in other countries, whereby you just go to the association website and just type your registration number and you can download your insurance or any other thing. And also, is there any plan to, instead of making this our license just the paper form and things like that, is there any plan of just making it like a card? And we just know, okay, we have is it a digital card that once you graduate, you just have your card. What you just need is just to keep renewing it. And once you tap it or you type it, or anybody needs it, you know, just like all these nursing council and things like that. Is there any plan for that, sir? That will be all for now, sir. Thank you very much.
Sorry, I didn't get that second one. Is it about payment? You said if there is any digital card. What was it about? I didn't get it.
I'm talking about my own license now. Now I've renewed my license, or I've paid up till next year, and I've submitted my CPD, everything. But now, since we are having 2 years registration now, do I need to add half of 1 year to get 2 years now? Because I already have this year now. I paid for this year and next year. And now, next year, by next year, it will
be. Okay. I get what you mean.
Do you get what I'm saying, sir? So do I need to just add half payment so that I will have 2025 and 2026?
Okay. So you have already done 1 year, 2025. So what you're saying is that since it has been issued and it's 1 year, can you add half of it and get for 2 years? Okay, I get it.
Yes, then
I get that. Okay, so
then
let me start
for next year, but I've not gotten the license. I guess it's still within the archive of MRTB.
Okay.
Yes, sir.
Okay, thank you so much. Number one, I think I've already mentioned this issue of the diaspora CPD, but where the challenge is now is if you don't have any evidence that you have taken it. I think that's where the only part that there is an issue, because there is no way we can accept something that we have not seen the evidence. Even here in Nigeria, someone called, they said, look, I'm doing a program in so university. Can it surface? I said, well, if that we have, it's acceptable, but you must bring evidence. And the person said, okay, what evidence do I bring? I said 2 things. Number one, either your transcript, the transcript of the program, that means maybe you have finished it, or if you have not finished it, let the coordinator of the course or the head of department just issue a letter to you or the board to say that you have taken that course, and then that will serve as evidence that you have taken that course. So the number of hours will be there so that we will now have the CPD computed from that. So what we can do, can I suggest that those in the diaspora, either one person or in group, just write to the board about this particular challenge and give solutions. If it means discussing, let's have just a meeting with few representatives in the diaspora. Let's be able to see what is it that can be provided as evidence. Even if it is the screenshot, let's see how can that really be acceptable to the board. I can't be able to give any solutions right now. But I know there should be, as I've told you, anything that is not really limiting us regulation-wise. We'll try to create a way to make life easy for registrants. So please, let's have this discussion so that we can be able to. And then this second question that you asked, you have already renewed for 1 year. Now, if it has not been issued and sent to you, you can write an email and let the registration department know that you wish to upgrade. It's going to be difficult for them, but in as much as it has not been issued, it's all right. But you must provide all the remaining things that you have not provided when you did for the 1 year. So if you pay 20,000, you can reach out to them. Don't pay first. Ask them that you want to pay the remaining 10,000, the half of the second year, and also you want to complete the CPD. Then they will say, oh, it has not been completed. If it has not been completed, it's okay. But if it hasn't, upgrade it to a 2-year license. You'll just be patient until that 1 year is exhausted, and then you now do the 2-year registration fresh. So I hope that's fine. Okay, Akachuku, peace. Yes, peace, you can unmute.
Good evening, sir. Thank
Yes,
you for
good
this
evening.
opportunity. Your protocol really observed. Please let me go straight to the point.
Okay.
As I said earlier, I acknowledge what you said. I'm a COP member, physiotherapist. Okay, I started my NYSC around June. So, and before then, I made inquiries about renewal of license because I was anticipating December that my license was expired. So when I asked your colleagues and all, they told me there was no going to be CPD points requirement. But then along the line, that was around September, October, I started hearing things that coppers are supposed to use CPD for renewal of license. But unfortunately, because of the time, I also acknowledge, I thank you for the efforts you're making right now to accommodate us with Studio Kotiba to have some trainings and workshops. I personally, I engaged in some workshops. For example, this application of rehabilitation domains that was done recently, I participated at Delta State FMC Asaba there. So I'm also, that's part of my question because the certificate for the workshop has not been released, and me personally, I'm anticipating using it as part of my CPD for my renewal of license, which is the date is 31st is almost around the corner. So I'm asking, please, when is the certificate going to be issued? And also, as a COP member, I'm pleading rather, since this 45 CPD point for some of us that at least attempted having participating in some of these programs, can it be reduced for us so we'll be able to renew our license? Also, another question I have is, for someone that wants to do change of name in the license, please, what's the procedure? I've been asking, but nobody has been able to give me a reasonable approach to it. Thank you, sir. Hello? Hello, sir. Are you there? Can you still hear me? Hello? I can't hear you. I don't know if you are still hearing me, sir.
Okay, sorry. I thought it was not too good. Yes, please go ahead.
Did you hear me at all, sir?
I didn't hear you at all. The network, I got disconnected immediately you started speaking.
Okay, I said that I am a COP member, and so far I've been able to. I've been able
Okay.
to. Hello.
Yes, go ahead. I can hear you.
Okay. I asked the workshop organized by Mrtb recently, the application of rehabilitation domain, the certificate. When are we expecting it? Seeing that 31st is around the corner, for some of us, me in particular, I'm hoping to use the certificate, the CPD points I acquired for my license renewal as a corp member, seeing what we are going through now.
Okay. So let me just say this to all those that attended. Okay. Okay, are you done?
No, I'm not done. Then the second question is, the second question I pleaded as a corp member, seeing that because it is just last 2 months that we knew that corpers are supposed to renew our license with CPD. So I'm pleading rather, this 45 CPD points, is there any way you can maybe reduce it a little bit for us? Corpers, maybe they have at least 30 or 25 to be able to renew. Then also, I asked about someone that wants to do change of name in the license. What's the procedure? For all, everyone has been asking, nobody is able to give me a reasonable approach for the application. Thank you. Hello, sir, are you still there?
Please.
Can you
Yes,
still
I
hear
picked
me?
2 questions. Let me answer them so that if there is any other one that I've not had because of the network, I will then. Yes, so let me answer the 2 questions that I got so that if there is any that I've not gotten, then you can say it. I don't know whether the network is from you or from my own system. Number 1, you asked about the certificate for the last workshop. Hands-on workshop. And let me say this to all those that were on the attendance. And Mrtb officials or the facilitators have your record. Just go ahead after making your payment, send an email to registration@mrtb.gov.ng, attach the evidence of payment and the remaining CPDs that you have, and then state there that you attended the hands-on workshop, but you have not received the license, the certificate. That will suffice because in as much as you have attended and they are processing the certificate, the registration department will accept that and they will process the license. So in as much as you have attendance, where the issue is if you don't have attendance, you assume, then that is where you have an issue. But if you are very sure you are on the attendance, then that will surface. The certificate will come to you soon because I know they are processing it. There were more than 300 people that attended at the hands-on. That is that. Then the issue of 45 for corpus and hands-on or whatever. If you can't be able to get 45 or you can't pay 30, please go ahead and give 30 CPDs and the amount that is relevant to your level of experience and get for 1 year. So that by next year, you can plan towards having what will be enough to renew for 2 years. So the 2 years and the 1 year are both options are there. So you can give 30 CPD and either 13,000 or 20,000 to get a 1 year license, or you can pay 1.5 of each of the fee and the CPD units and get for 2 years. Whichever one you do is acceptable. But the only thing is that if it is 1 year license, next year you have to renew again. If it is a 2 year license, you are not going to renew until after 2 years. I hope.
So, sir, if I have 30 CPD points and I want to renew for 2 years, am I able to renew as a corper? Hello? Hello?
Hello? Hello, sir, are you still there? Network. Oh. Hello, sir. Sir, are you there? Hello, sir. Like you've been cut off completely. Oh. Okay, like he's cut off. Like the network is from his side, not mine.
You can just keep it by the side. If this one goes off again, we'll use it. But yeah, I keep going on and off, but I've gotten someone that has a better network. Sorry, this is going to delay us, but let's see what happens. Going forward. Yes, who is next? Okay, if Aisha is not there, can we have Emmanuel Ogbonaya?
Hello, sir. Hello, sir. Can I speak?
Yes, go ahead.
Okay, sir. I want to ask about I'm currently an intern. I want to ask about I'm currently an intern. I've seen some places when we want to go for NYC, they will ask us for our physical license. And I don't know if NYC will allow us to enter the camp without physical license, with just the digital license. Because I've seen some stories whereby some people are sent out of the camp, are not allowed into the camp because the camp presents a physical license or the color of the license is different from what they are used to.
Okay. Thank you. I'm with the HOD registration right now. And when we heard of those challenges, because it was an oversight, when we changed the license, we did not write to NYSC. But when we had people had difficulty, what we did, instead of reaching out to the different states where there were issues, we went to see the HOD registration, went to see the DG, is it DG of NYSC? The DG himself. The HOD met the DG himself, explained to him, and the DG asked that we write. He said, if we write and attach the type of license, wherever corpus go to in every state, they will write to all states and ask the states to accept that license that we provide. And we have done that. And immediately after they did that, all those that were complaining around the states reached out to us to say that they were accepted. So all those that will be going in later, I believe you are not going to have such a problem because we have already written and they have already communicated to all the states. And what we are going to do is that going forward, whenever we have a change in whatever thing that we have, we'll look at those relevant agencies and write to them so that our registrants will not have any challenges. Yes, so Rita Ogidan. Rita, are you there? Okay, divine favor. If Rita is not there.
Hello,
Okay.
I'm here, sir.
Okay, go ahead.
Yeah.
Go ahead. Go
Okay,
ahead.
good evening, sir. Good evening, everybody. Thank you so much for this opportunity you're giving to us. My question is for those of us that live very far away, like I'm practicing at Mrtb, and sometimes those hands-on that have been organized, it's usually difficult for us to attend because of the security issues. So I don't know if, and I'm kind of pleading, if it could be possible for them to bring it closer to us instead of arranging for us to go far away for security issues. Because it's like all of us in the state, none of us were able to do hands-on this year, but we had our, as in the other CPDs, we had them, as in we had more than enough CPDs, but we are not having hands-on. So I don't know if they could bring it closer, maybe to a place like Sokoto, or I think Sokoto is okay. I don't know if it's possible.
Well, it's very possible. When we chose one state in each zone in the last program that we had, the last hands-on, we made it very clear that every state that can be able to gather up to at least 10 participants, we can send a resource person. And this goes to any state. And even going forward, you don't even need to wait until the time that Mrtb organizes a general workshop across the country. If in the next 2-3 weeks, you wish to have a hands-on workshop, just reach out to Mrtb or any other organizer for that matter, whether it's associations or just reach out so that it will be organized, first persons will be identified and will be sent to the state. Because what we want is to open up this so that everyone can be able to benefit and let's advance our profession. So there is no limit to that. The only limit is if you cannot be able to have up to the minimum number, because logistics needs to be taken care of. People will be paid their transport, their accommodation if they are not residing within that state. So that's very possible.
Okay, sir. Thank you. Thank you so much, sir.
Thanks. Yes, divine favor.
Okay. Good evening. Yeah.
Good evening.
Okay.
Divine favor, go ahead. We can hear you. Oh, you are muted again.
Okay, sir. Can you hear me, sir?
Yes, we can hear you. Go ahead.
All right, sir. Good evening, sir.
shouldn't be from here. It's from him, right? Okay, Divan, if you are having network challenges, let's have Lukman Abdullahi. Lukman Abdullahi, go ahead and speak, please.
Thank you very much, sir. Good evening.
Good evening.
Yes, sir. My own is like an issue that I've been experiencing because one of the required documents to process a new license involved the presentation of the previous license. So I was trying to get my license for 2024, and when I sent the email, I provide everything, and within 24 hours, I was notified that they will process it, and I will get back my license within 3 working days. But later on, they realized that I made a mistake while sending the remitter. I mistakenly sent 2019 remitter. So they quickly respond to me that I should send the current remitter. And when I did that, they said they will get back to me. That was in April, I think it was in April. But up till now, I have sent like 6 reminders, but still I did not get my license. I've been trying to like reach out. I even sent email to the complaint, Mrtb complaint email, but they did not reply to me. So I don't know the issue, and I need to get it in order to provide it for the next license that I want to renew.
Okay. Thank you. So I'm going to ask the HOD to speak because all these things that we are discussing, it is registration department, and the HOD is right here next to me. Number one, before I hand over to him, let him explain why they have not responded to 6 emails that you have sent. And what they have in store for us going forward, they will give us assurance that these things will not continue to happen. Because if not, we will hold them responsible. Now they are getting salary, so there are no excuses. But this issue of asking you to give your last license, this is going to stop. I assure you of that. Because I also thought, why should we be asking people for their last year's license when we were the ones that issued the last year's license? But what I realized was that there was no record in many files of previous things. This is just to be honest. That's what I saw at some point in time. And therefore I said, before I sign any file, I must see every record in the file. The HOD is here. Sometimes they will come with 50, 70 files. And I will say, if I don't have all the records, I'm not going to sign. Now, another way we can be able to get the records is through remitter. If we have your name, we go a remitter, we get it. But unfortunately, in the past, some people will pay in bulk. And therefore, the only name reflected will be the person that paid. And that way, you cannot be able to go back to remitter and get the record that people have paid or their license has been renewed. And therefore, I want to plead with everyone. Make sure when you are making payment, you make payment in your name. And I've already informed the department. Things are getting better because now most files that will come, I will see the license of last year, I will see the payment for last year and the years before I sign. And this is helping us now to have the records. And now that we are going online digital, everything is going to be digitalized. And therefore, who is going to ask you for your last license when your last license is already on the digital platform? So apology for all the hitches. Let me just ask the HOD to speak because I think it's important for him also to begin to see what registrants are going through these interactions. HOD.
Thank you, the registrar, CEO. Again, I apologize, Lukman, for that incident of 6 months of you not getting your license or any feedback from us. Just like the registrar have said, I really want to assure you that by tomorrow morning, we'll give you a feedback on that. And one of the reasons for that, your previous license, is for us to drive documentation process to keep our statistics and records straight. But well, I assure you that if you provide just your license number or your full name, we could look into your file and give you whatever details you need to get or to provide your license so you can carry on with your renewal. So again, not to take your time, sorry for that. I'm sure you are looking into it. Thank you.
Okay.
Thank you, sir.
Thank you. Yes. Next, we have Sharif Balogun.
Good evening, sir.
Yes, evening.
Yes, sir. Thanks so much, sir. Sir, I already have 30 CPD and I'm an occupational therapist, but I've not done any hands-on. Can I go ahead and pay for 2 years, 30K now? I can do that tomorrow. Can I go ahead?
No, if you don't have hands-on, you can't renew for 2 years. You can go ahead and pay for 1 year, and then next year you can now work towards having the requirement for 2 years. Then at the end of 2025, you can now renew 2026, 2027, 2 years at the same time. But if you can be able to get hands-on before the end of the year, then you can delay it, get the hands-on, and then come and pay and renew for 2 years. But if you don't have all that, the best option for you will be just to pay 20,000. Are you above 10 or below 10 years of experience?
Above 10, sir.
Above 10, that will be 20,000. So pay 20,000, submit your 30 CPD, renew for 1 year. But if you can get from now until the end of the year, the hands-on, then you can now apply for the 2 years.
But I don't know if MRCB will still organize hands-on for occupational therapy before the end of this year, sir.
Sorry?
I don't know if there will be arrangements for hands-on for occupational therapists.
I've reached out severally to occupational therapists, asking them to work with the board to develop a program for CPD. But up till now, we have not been able to work out anything. So you can reach out to colleagues, because you don't have to wait for any organization to do CPD for you. If you can put together few, reach out to us. We can support you and facilitate so that you can get the CPD. You don't need to wait for any organization. Just reach out to us, put yourself together, reach out to colleagues. If you have at least 5 to 10, we'll find a resource person and we'll facilitate. At the end of the day, I assure you, if you are not many, because I know occupational therapists are not many, if you are not many and what you pay will not be able to take care of the resource person, we will support you with funds to complete it so that at least you can be able to have the CPD. It's not about renewal of license, but it's about you being able to advance yourself. So just go ahead. If you have up to 5 people around a location that are ready, we'll send someone to come and give you. But if you can't be able to do that before the end of the year, just renew for 1 year and plan towards next year.
Yes, I'll work on that, sir.
It's okay. Well done.
Yes.
Prof. Jibril Muhammad.
Good evening, sir. Prof, sir. I just have some suggestions. Good evening, everyone. This is Jibril. I think if the people that are developing the website or the portal now, if you may call it that, on it, we can have it in such a way that everybody will have his page, so that you can have a login details. Probably you've thought about this, but going further, for example, if we have 4 categories of CPDs, people can indicate, okay, how many points do you have on, say, administration? Then you can fill in maybe 6. Then there's a place you can upload the certificate or the evidence or whatever. I think this will go a long way in helping the back end. That means the people at the board to clear this very quickly, because I am sitting here, I see that you are still in the office, and I know that it's not very easy. Registrants, if not because many people are even out of the country and all of this, I can imagine handling about 5,000 registrants, and we want to do some of these things either manually or semi-manually. Going forward, it will be a lot of stress on you guys. So I want to say kudos to the board and others. Then, sir, I have a question. If you are on a training that is not really structured, me in particular, I'm on a training, and I don't know how to really put it. Is it something clinical or hands-on and research? Because it comprises so many things, and it's sponsored by an organization. It's not going to be easy for you to write to that organization to say, oh, prove this, and this for me. I don't know how the board, because this maybe it's an organization that is well known, and is it enough if you just go online and look at some of the things that are on it and you make decisions? So these are my two concerns. Otherwise, it's just the comment I wanted to contribute to see that we can make the website more better so that your previous licenses can even be on your portal. So that, because most times, anytime I want to renew licenses, a lot of stress. Thinking, where, like now I'm here outside the country and I've left my license in Nigeria. I don't know. Thank you very much, sir.
Thank you so much. So I tried to log into the portal, and it asks for username and password. So every single individual will have their own page, and when you get into that page, you can go to where you'll apply for license. What is being done now is to create a link where you upload the CPD. So I think the HOD has already noted what you have said. When he goes back, having the training with Prof. Ibijon, if there is anything that you have said that we have not captured, he will let them know so that they can include it. But I know the first thing you mentioned, there is a page for every single registrant. And when you go there, remember I mentioned it earlier, you can upload, you can make payment directly, and you don't even need to upload evidence of payment. I remember the HOD was asking Ibijon, how do they upload evidence of payment? He said, why do you need to upload evidence of payment? The moment you make payment on the portal, because what is it that they call this payment system, that it's there, you just use your card, and when you make the payment, the evidence goes to the registration department directly. And when they issue the license, they will go onto the website, the portal, and then they will upload it on your own page. So that if you log into your own page, you'll now go to a place where it says download license, and you'll just download the license. So that is there. But as I've said, he has noted what you have said. If there is anything that's not there, they are going to make sure that they look at it and consider it. The issue of training not structured, please, just like I said with our colleague in the UK, you two are in the same situation. Write to the board or reach out in whatever.
Network. Okay.
Hello.
I think someone muted the whole thing. Oh, sorry. I didn't even know that I was muted on the other device I was using. So please go ahead. Muhammad Abdullah Idris, go ahead.
Yes, assalamu alaikum. Good evening, Prof. Good evening, everyone. My question is regarding those who just came back from their postgraduate studies and have not renewed their 2024 license, and they don't have a CPD. So will our certificate or the transcript served as a form of CPD for us? Because we need the CPD, we need the certificate to also renew for this 2025 and then the 2026 license. So that's my question. Thank you very much.
Okay, for the 1 year, it's not structured according to those 4 domains for the 1 year. Of course, there is need for theory and also hands-on, but it's not as it's as structured as that of 2 years. So if you have a postgraduate degree and what you have there is relevant to the practice of your profession, we can accept 30 CPD from it, from the transcript, and you can renew for 1 year. But if you want to renew for 2 years, and your postgraduate degree can cover 5 units of research, it can cover 15 units of theory in practice, but you don't have leadership and management, it can't cover professionalism, it can't cover 15 units of hands-on, you don't have what it takes to renew for 2 years. So you just go ahead, renew for 1 year until you are able to provide all the remaining before you can be able to renew for 2 years. But if you have time and your PhD or master's has covered some of the domains, and you go ahead and you get the remaining domains, you can use part of your PhD, part of the CPDs from your PhD or master's, and you can use part of it from other workshops that you do, merge everything together and renew for 2 years. So that's it. So your master's or PhD or any postgraduate program cannot cover all the 45 for 2 years. Don't apply. Go for 1 year. Yes. Okay. I think next is Vincent.
All right. Okay. Thank you, sir.
Yes. Thank you.
Okay, sir. I would just like to find out, sir, if there are still, although you've spoken about it, if there are still workshops that can still be organized for those of us that still have challenges with CPD, physiotherapists now, before the end of the year, sir. I would like to, if there are any, sir.
Is it as a COPA or is it at someone that has been practicing? Okay, maybe let me just answer from both perspectives. If it is as a COPA, please reach out to Chijioke or Tipa. I don't know if you are on the Mrtb workshop platform, he's there. If you are not, then just try to get his contact, reach out to him. He's going to coordinate for COPAs and those that finish internship but have not started their NYC to be able to have that workshop free. Chijioke is there. I can just see that he said, I'm here. So please just send him a message. And if you are a COPA, but if you are not a COPA, then just like I explained to the occupational therapist, that you can put yourselves together in as much as if you are a physiotherapist, then you must reach 10. Because I know there are many physiotherapists out there in every state. Occupational therapists are not many. It will be a challenge having up to 10. And they are the ones that I said the board can subsidize for them and give some subsidy so that they can be able to have someone train them. That's for this year, just to help everyone get what they need to have. So that's it. Fatai Ekundayo.
Okay. Good evening, sir.
Yes,
good
good
evening,
evening.
Prof. First of all, I will start by actually appreciating your effort in trying to actually rectify this issue. So my question is, some of my colleagues, we just finished an internship in our facility, and we did the hands-on training that just ended a few weeks ago. And then how do we indicate so that it will actually appear in our license? Because we just apply for new registration as an intern. Now you have to actually apply for new registration. So how do we indicate so that it will actually appear in our license? And that's one. Please, can you also throw more light on the application for the new license, and then how long does it take? Like 2 years or 1 year, like other licenses? That's what my own questions. Thank you.
Okay. So you have finished your internship, right? You want to apply for full license.
Yes.
Well, you want to apply for full license. You know, as mentioned earlier, as an intern, it's good to upgrade yourself even beyond what you have been taught as an intern. But we don't ask interns to provide CPD to get full license. It is when they get full license that they now want to renew that full license, unless if they finish the internship and they have not, anyway, if as much as you finish internship, you're applying, we don't ask for CPD. But when you now get that full license to renew again, you must have CPD for you to renew again. It is when you are doing your NYSC that the question keep coming that we need to do CPD. So in as much as you get the full license after internship, you must have CPD to renew license, even as a corper. So that's the issue. And therefore, when you are now applying to get your full license, if you attach the CPD, it's okay. But if you don't attach it, we'll still renew your license. What was the second question that he asked? Okay, about the issue of the new license. The new license is for 2 years. And therefore, when you finish your internship, you want to now apply for full license. If you pay 1.5, what I mean by 1.5 is that you will be paying 13,000. And therefore, if you want to pay for 2 years license, you pay 19,500. And instead of 30 CPD units, you will now pay 45. Sorry, you provide 45 CPD units to renew for 2 years. So that's the new license. Therefore, when you renew now, for example, it will be for 2025 and 2026. So you are not going to renew again until the end of 2026, and then you renew for 2027 and 2028. Yes, John Bosco Obu. Yes, John Bosco, I think I've asked you to unmute. Okay, I can't see you again. I don't know whether. Okay, let's see. Maybe it was the hand, John Bosco. Okay. Yes, John Bosco, unmute and speak.
Good evening, Prof.
Okay. Yes, evening. Well done.
Good evening, Prof. Good evening, General House. Standing on the already established protocol, I appreciate your work for Mrtb, sir. You have given a new face to the board, and your works are already speaking for themselves. That said, I have a few concerns. Going straight to the point. Number one is about the interns that are being mentioned now. Now, I remember I used to have, one-time head of department. What he is doing or what he did during his tenure was quite apt. Apt in the sense that he believes that every license that goes beyond that date that is issued, that is meant to expire, once it expires, you practice even an hour after that you a quack. That is him. So what he believes, because of that concept, when interns, students come to do internship, sometimes a good number of them may have spent some months in the house, maybe just coming in to do internship, and their license is just 2 months old to expire. So once that 2 months goes, he usually will request that they go to the board to renew their license, because they won't practice in his department with an expired license. That is provisional license this time around. Now, I want to ask, in your board, do you have provisions for renewing provisional license? And again, in line with this 2 year license, what will the amounts be for an individual to, if perhaps such a person falls in a department that is as thorough as this, that wants to request every intern practicing in that hospital to have an updated license that should cover for the period of internship, and not to just rely on the already provisional license that was given during the time of graduation? That's one.
Okay.
Hope you're hearing me, sir.
Yes, I can hear you. Go ahead. I can hear you.
All right. Now, the second one I have is this. In the course of hands-on, which is key, I learned you had some other requirements that you mentioned, which perhaps I didn't pick all of them. But I want to ask specifically for those who are in the directorate cadre in most hospitals, they're already trainers that have trained a couple of interns that got passed through them. And in fact, you see them as, I may call them doyens of their own various clinics. Do you have provision for such individuals to renew licenses without going through the hands-on again? Or must they also be subjected to the hands-on Mrtb workshops? That's I want to know. And then the last but not the least, for those of us who have also paid for 2 years license without before this information is coming to fore, what will be our fate if perchance we are not able to have a hands-on workshop before the year expires, having paid for the 2 years already? Thank you, sir.
Okay, wonderful. Well done. Thank you, John Bosco. Now, number one, we renew provisional license. Because just like you said, you'll be a quack even as an intern, because that's the reason why you are given the provisional. Because without the provisional, it means you can't practice. You have not even finished school, or you have not been cleared to go and practice. So that's number one. It's 10,000 naira. I just turned around to ask the HOD, because it's not something that we very commonly do. I couldn't even remember that. I thought it was 5,000. He said it's 10,000. So if your provisional license expires and you have not completed your internship, you will pay 10,000 and you will get renewal of your provisional license. And then when you complete your internship, you come with evidence that you have completed your internship with your logbook and all other requirements. You now get your full license. So that's number one. Number two, the issue of directors, it doesn't matter. Whoever, everyone must do a workshop. Because who says a director will not need training from another person? There is this saying that above every learned person is someone more learned. And another thing is that every single day researches are being done. You can be a director, you can be a professor. But when you read that article, you see that the person that did it, it is complex, that you can't really understand how it's done. You will need someone to train you. It doesn't have to be locally. Sometimes you can reach out to the person that wrote the paper in another and say, this paper, I've read the methodology, but I can't be able to apply it to my patient. Please, how do we get training from you? And then we say, okay, well, I'm too far, but someone from Cameroon, someone from Nigeria, but another part of the country came and he did his PhD, he did the training. Let me link you up. Let him. There must be something that you don't know. You can't know everything. And what CPDs are all about is to upgrade the practice. Everyone should be able to move from where they are to another level. And don't tell me in physiotherapy that all the directors that we have, they have mastered all the art of medical rehabilitation profession, and therefore they can't be. Sorry to all those that are there if I'm mentioning one profession. I don't know if I did that. I'm sorry. It's just so medical rehabilitation profession generally. So that's number two. Number three, if you pay for 2 years and you can't get the CPD completed and you want to now renew for 1 year, the remaining money is there, but it is 10,000 if you pay 30,000. If next year you want to pay for another 1 year, you still need to complete 10 to make it 20,000. If next year you want to pay for 2 years, you have to complete 20,000 to the 10,000 and pay. All you need to do, send an email to registration to say that I paid for this amount, but I don't have the CPD. I now want to do for 1 year. Please, I'm notifying you of that remaining. I've got an email. Please check. They copied me, someone that did something similar. And I told the person when they reached out to me that we are going to reserve that extra so that when next they need it, they will use it. It's difficult for the department, but it's your money. We can't just say that it will not be used for you, but we can refund. But you can keep it for next year's license renewal. Thank you. Next, I think, is Sandra. Madam Abdulhadi, raise your hand and speak. There are many chat messages on chat forum. Yes, good. Go ahead. Is it Sandra?
Yes, sir, Sandra, sir.
Go ahead.
Good evening, sir. Thank you very much for this opportunity, sir. Without wasting much time, sir, I just completed my service year as at September, and while during my service year, I asked certain questions. I messaged some admins to confirm my doubt as regards the CPD workshop and programs. Yes, and all the response I keep getting is, see, corpers don't require CPD to renew for the renewal of the license. And as much as I would have loved to participate, the area where I was posted to, this was local, so network was like really poor. Then workload, I had to like assist a number of times because the hospital was short-staffed and workload was a lot. So I would like to ask, how do we go about this? Because I feel like there was like miscommunication along the way, because all we keep hearing from my fellow colleagues, from the board, from representative of the board, yes, was we don't require CPD workshop for the renewal of license, sir. So I would like to confirm how this can be sorted out, because most of us have not like acquired the required CPD for the renewal of 2025 license, sir. Thank you, sir.
Okay. Thank you very much. Now, that number one, make sure when you are seeking for information, you seek for information from the right department. Anything about registration, send message to registration@mrtb.gov.ng. It's very possible you go to a staff of the board or you call a staff, because people have been doing that. Up till now, people are reaching out to our staff in Lagos because that's where license used to be renewed. And at some point, we reshuffle and send some staff in registration to other departments, because at some point, registration had accreditation and institute, and therefore we moved. So someone that is known to be in registration that moved there is an information that even them might not really get fast, because it's not their job to do that. Even though sometimes we have general meetings or we release circulars on platforms for everyone in the board to get to know. But in a nutshell, just make sure you ask the right person. And if it is about registration, let it be registration@mrtb.gov.ng. The issue of people not getting replies, I assure you that will stop. You are going to start getting replies. Of course, it's not going to be as perfect as we want it to be, but it's going to improve. I assure you of that. Then the second thing, what was the second question?
How should I get the municipal?
Wherever you are, that principle will apply to you. No matter how remote that area is, that's why we are here. That's why we are here. Reach out, complain. Let's look at the area and see. Yesterday, or was it 2 or 3 days ago, that I said, corporates, look, I'm going to support you. I will do workshop for free. I will ask some of my colleagues. Right now, I think on the platform, there are about 4 people that volunteered. They say, oh, I will help. I will help. I will help. I know people that wouldn't mind paying from their own pocket to go to a remote area to do a workshop. I know many people like that. So we are here to support each other. We are not going to say we have waived. The moment we waive for you, many other people will tell us that their NYC is in a remote area. So you must do it. But if you need support, reach out to us. We'll advise you, we'll guide you. Where we can send someone to you, we'll send someone to you. I know maybe I'm too ambitious trying to say we'll help everybody, but all I know is that we are not going to just forsake you and just leave you there to be alone. Even if we don't send someone, we'll advise you on how you can be able to do your workshop. It doesn't have to be online. We can package the materials and send to you through bus. You go to the park. No matter what village it is, there must be a way that you got there. That park, you will collect it, you read. You will now write down your summary of what you have learned from it, send it back to us, and then we'll now use it to say you have done your CPD. Is it not about knowledge? Then if it's the hands-on, it's once in a year. Whenever you get your leave, you will now come into the city and you join others and do it. So there must be a solution for every problem that we'll have. Thank you. Esther.
Good evening, sir. Good evening, everyone. Can you hear me, sir?
Yes, we can hear you. Go ahead.
Thank you so much, sir, for the opportunity to speak, and thank you for all the questions that you have addressed. My question is, I finished my internship in September 2024, and I applied for my license, and I paid 35,000 naira. But my license came with issue date of October 4th and expiry date of December 31st. And I was quite disappointed because I was looking forward to having a license that would last me throughout my NYSC year. And so I didn't know if I was supposed to pay another money to renew my license again, because I just got a license that lasted only 1 month and I paid 35,000 naira. So I was a bit confused, and up till now, I don't know whether I'm supposed to apply for another license after paying for, the one I paid for previously. Thank you, sir.
Thank you. Actually, we have discussed this earlier. From what month is it that you have October? So anyone that renew before October, you must renew next year. Yes. But if you renew after October, it will last you until the okay. So I was just getting that straight from the HOD. If you apply before October, then it will only last you for that year. You have to renew for next year. For if you apply after October or from October onward, then the license will cover remaining of those months and then the next year. I said this earlier, that's the regulation of the board. I met it, and that's why I was even asking the HOD just to confirm, because this is something that I met on ground. And as I've said, anything that is institutionalized, we have to go through process of review. So when next we have a governing board, we can decide to present it and say, well, these young guys, they just finished internship or whatever it is that they have finished, they are young. Do we say let them pay half if they are paying from mid of the year or something like that? But as it is right now, there's nothing that I can be able to do. But I assure you, this is something that we'll consider. Please put it down. Whenever we have a governing board, let's make a submission to ask for them to pay less, even if it is half of what they will usually pay. Thank you. Ifeoma.
Thank you, Professor Rufai. I just have a simple question, and that's with respect to the leadership CPD. I just wanted to be very clear on what constitutes or what can constitute this leadership CPD. I was going to ask that for some of us who practice outside the shores of Nigeria, part of our role as maybe from band 6 upwards in the UK, you were expected actually to have supervisees. This is like a practical, hands-on leadership role. It's actually helped to groom you. You were expected to lead MDT. If you have evidence of all this, does it constitute, is that going to serve as leadership CPD? And also in the trust, we do also have opportunities to attend some leadership programs from resources like NHS, from resources like Future Learn, and these global recognized institutions. Would that serve also as CPDs for the leadership management aspects? That's what I'm not clear about.
Yes. Yes, yes, and yes. They will serve because they have leadership and management things that you have talked about. In fact, we'll even prefer when you get the knowledge that you have the practical, and what you are talking about is beyond just going for an online CPD and you just present it and say that I have done leadership training. It will serve. And I think I've mentioned it earlier. Whatever you do in the diaspora, all you need to do, just get us evidence that you have done it. Because you can't just verbally say that I did this course, I did this course, I did this training, I did that training. But some of our colleagues in the diaspora have complained that they have difficulty in getting the evidence. Someone said, can we take a screenshot?
Yes,
said,
sir,
well,
that's because,
write to us.
sorry, sir, you're
Yes,
very correct.
no
They're
problem.
very correct that they can have difficulty in getting the evidence because the system is built in such a way that in each of your laptop or work laptop, because the government wants to have a way of checkmating the trust itself to ensure they are making their staff to do what they're supposed to do. So in the system already, it seeks out when you've completed a particular training, and somehow it goes directly to the trust. It's not something we have access to, but you can actually have a screenshot, just like they have rightly said, of all those programs. Because the truth of the matter is that in every trust, right here, you must do a yearly appraisal. And not just that, every month you're doing a monthly supervision with your supervisor. And so these, in fact, there's no way you're here and you can't do those CPDs because those things put you on your toes. So I will also lend my voice to that if you, because I know that it's important for us to be able to evidence what we have done. If we can present also screenshot of all those things, that will also give you an evidence of the fact that those CPDs has been done. It will really be very helpful.
Okay. That's why I said let few colleagues from the diaspora write to us. Because what I'm thinking is that if we write, say, to the trust, we write to an authority and say, please, we have registrants that, and this is our rules. In Nigeria, we need certificate evidence to show that someone has done this or that. But we have been informed of this by some of our registrants that practice with you. Now, then we now ask the question. Whenever someone works with you, is that guarantee that they do A, B, C? We say
Okay.
yes. Then we cannot take it that when we get that evidence that they work there, that we may not need to go further to ask for those individual things. But then the second thing is, if you are working there at the beginning of the year and you leave them, and at the end of the year, you now come and say, I have this evidence that I've been working there, and the evidence is from the beginning of the. So these are the things that I said, let's discuss. I wouldn't mind having another separate meeting with colleagues in the diaspora. Let's get to know your peculiarities. Let's get to understand what is acceptable, what is not acceptable, so that at the end of the day, we'll be able to now say, let's adjust our rules to accommodate you. Because it's not your fault that you cannot be able to get that thing. It is the rule of the countries that are outside. For example, in Nigeria, I know universities, even the coordinator can write a letter to say, this person has done this or that. But if I know in Nigeria, we can't be able to get that. Even for the Nigerian people that are doing masters or PhD, we'll be able to say, okay, come, let's sit down. Let's see how we can waive some things for you. This system is not meant to make life difficult for people, for registrants. But there are rules just to make sure that there is sanity in the system and principles are followed for the purpose of upgrading ourselves to help those that we serve. So I think this is just the basic principle, but there is nothing that is rigid that you must make life difficult for people. So thank you. Inamdi Ibe.
Yes, I'm here, Professor. Good evening, sir. I
Good evening.
commend you for your efforts so far. Just want to ask a question. For someone that has not renewed license for 2022, 23, 24, what's the implication in terms of the penalty and the procedure to renew the license before doing the one of 25, 26? The another question is more of a suggestion because this question about diaspora renewal of license and CPD, it will keep coming over and over. Just like you said so far, if you can just possibly take your time, organize sort of a diaspora meeting with people in diaspora to have meeting with them from different countries so you can understand their peculiarities and possibly draft some document and iron some things out on how they feel they can against their CPD. Because in my own understanding, I think most of those CPD can also be evidenced through the managers, just the same way they request for letters from HODs from Nigeria. So managers can write that you've done this CPD for the year. And another thing I want to possibly suggest because this was not it is possible for MRTB Nigeria to have Telegram where we have the
I can't hear you. The voice is very low. It's a little bit better, but it's still very faint.
Okay. Can you hear me?
I can hear you very well now.
Yes. So what I'm saying is if it's possible for MRTB Nigeria to have an open Telegram group where we can pin all those frequently asked questions, because we have more than, let's say, 5,000 physios both in Nigeria and abroad, and in this meeting we just have less than 500 people in the meeting. So it means that this question will still come back to you people over and over in your email, which is going to be bombarding to you people and going to be difficult for you to answer. So if you can have an open Telegram group where people can possibly go to the facts and see those questions themselves and the answers already provided by the Mrtb Nigeria. Do you understand? So that it will be easier for you to possibly iron some things out without having to keep on responding to emails from different people from all corners of the world. So that's just what I want to suggest. So my first question was about license renewal for 22, 23, 24. That is the past 3 years and how they can go about it. And second one was about suggesting the diaspora meeting with the board. Even if it's going to take maybe towards next year, we can have the meeting with the board. So we can possibly suggest what we feel is going to be used as evidence for the CPD point. Yeah, just what I want to sort of clarify.
Thank you so much. I'm going to ask the HOD registration to answer the first question about the issue of what it takes to renew from 2022 to date. So quickly do that.
Again, good evening, Namdi. I'll just quickly want you to drop your license number or your full name for us to check. If you want to renew from 2022 up until 2024, you need to pay your backlog in terms of your license fee for 2022, 2023, and 2024. Then we have a fine for staying off the record for 3 years, which implies that you need to provide your CPD for all these years, knowing fully well that things has changed and the board has reviewed the price for CPD. At a point in time, it used to be 10,000, but for now, from 2023, it has moved up to 50,000. But the truth is that if you are above 10 years, for those backlog, you need to pay the sum of 20,000 naira per year. That's for 2023 and 2024. For 2022, then it was 15,000 naira. Then we have the fine. So all this information will be sent to you directly. Either once you drop your license number or your email, or the platform will see it and send to you. So it's that simple. Thank you.
Yes, thank you so much. Then the issue of meeting with colleagues in the diaspora, I would really love to have that. And it's not just even we trying to find a way to help you. I would really want to use that opportunity to see how you also can help us. Because all these CPDs that we're doing, I know many, just like you said, someone showed me their platform. And I saw the beautiful workshops and trainings that we want to do here that we don't even, some of us don't have the skills, they have gotten that. So we can discuss, how can you support our colleagues that are here, support us, we that are here, and also we'll then see how can we support you to be able to renew your license seamlessly. So I would love to do that. The only thing is that I'm not sure how we can communicate with you if there are representatives across the countries. Maybe if I can be able to get the contact, and then I will contact them, send the link, discuss the date and time that will be convenient for all, then send the link, and then we'll do that. So I will drop my phone number and email so that anyone that's from the diaspora that want to give me some guide on how we can be able to connect with all across the world, then help send a message that will do that. Before we finish, I will send my phone number and an email address. Thank you. Ile, please, if Mrs. Ile, if you are there, I think I've lost network in the system that what is it called? Host. So please help me unmute Olufemi Oyewole. Yes, Mrs. Ile, I think you are a co-host. Unmute Olufemi Oyewole.
I've done that now, sir.
Okay, Ms. Olufemi, go ahead.
Yeah, good evening, Prof.
Yes, good evening.
Yes, this is Dr. Oyewole on the line.
Okay.
Yes, just a clarification and form of suggestion concerning the CPD regarding those domains. Yes, I just want to be sure whether those suggestions they are accepted or they can count as a form of domain. I mean, a form of domain for research and leadership or whatever. Some of us in the clinics actively involved in research. We are actively involved in research. We run an ethical approval with the ethics committee. We go to the field, perform the research, and publish the paper. Can that as a research domain for us? Some of us in
Okay.
the clinic, we are facilitator to some of the some organizations to come and give some leadership talk, some research talk, and they gave us some certificate to be as a facilitator. Can that serve as a form of CPD?
Okay, thank you. Actually, just doing the research and publishing the paper will not serve. And the reason I say this is because it's very possible that someone may do the research using the wrong techniques and the wrong principles. And just because they publish the paper, and I know there is the issue of peer review, so it also depends on where you publish it. But what we are after is you learning how to do it, you getting the knowledge and getting the skills. Of course, doing it, if you have someone that's guiding the principles and giving the knowledge, that will be acceptable. And remember, this research from the perspective of the board, it is not just about someone being able to do research. If you look at the list of topics under research under the WHO Rehabilitation 2030 agenda documents, the Rehabilitation Competency Framework, it is not just about the ability to do research and publish. What they are after is more or less evidence-based practice principle. How can you deploy research to treat patients? How can you solve clinical problems using the research that you have done? So these are some of the things. And therefore, just doing the research as a clinician and you publish it will not suffice. You need to do a training on how to do the research and how to use the research and how to disseminate the research. So you are learning. And that's what that research component is. But going forward, because this is the first time that we are starting to ask for this, we'll look at the principle and see that should we separate learning about the research and doing the research? Because I like, was it Ifeoma or someone that was mentioning about the practical of having supervisees that train, and I say, oh, that's wonderful, because we need the knowledge and we also need you to put in some practical work to show that what you have learned, you can be able to do leadership. We can do that for research, but for now, we need something that shows that you have learned how to do it and you have learned how to deploy it to be able to treat, assess and treat patients.
Hello, sir. Sorry for a follow-up comment
No
of what you
problem.
just
No
said.
problem at all. No problem.
Yes. Now, when we are talking of learning about research and doing research, now we had most of the clinicians at different levels of their career. Some of them, they have their postgraduate certificates, some masters, some PhD, and they have gone to learn the rudiment of the research, and now they are putting it into practice. So can we say they have learned the rudiment, how to do it, and now they are now translating the knowledge into practice, engaging the research itself, doing it, send it for peer review, and they do it? Is the boss saying that does not cover research to me?
No, that's not what the board is saying. What the board is saying is that we want to be sure that you are doing the research in the right way. And therefore, the knowledge is also important apart from the skill. If you look at practice, we said
yes,
theory.
I said some of them, they have gone for the theory. They have gone for the theory of the research, and they apply that theory practically.
Then submit that evidence that you have gone for the theory. That's all I'm saying. Submit the evidence that you have gone for the theory. Then submit the paper that you have published.
With their master certificates, PhD certificates suffice for that theory?
Certificate will not suffice. We want the course content, and that's why we said either you come with your transcript or you come with a letter from your coordinator stating that you have taken a course on research, this topic, you then submit. So as I've said earlier, we may start with something that may look cumbersome and rigid. But as we move forward, in as much as the principle is established, we can continue to adjust to make things easier for people. But my problem, or our problem here at the board, is that we don't want to start with something that is too flexible and then it would be misused. But as we move forward, just like we are doing with the diaspora, we can also review our stand and say, okay, well, made it much easier. And that's why we are having this. We are taking note of all this. I might keep trying to argue that it has to be our own way. But that's what I always say it in class. I say, students, challenge us. Even if I don't accept it now in the class, by the time I leave, I will start to have a rethink. I say, that young man is right. Let me rethink it and see how I can adjust. The next class I go, I'll say, okay, look, I've thought of what you said. So please bear with us. We'll keep looking at these things. And that's why we're having this. It's not just to come and just push our ideas and whatever on you. We are listening and we'll continue to review and see how we can adjust things. Yes, so let's have Hafsat Hussaini. And I know it's getting very late, 10:19. I can see many hands, but people are still here. We are not tired, but if you want us to stop at any time, just give us feedback. If those that have raised hands want to stay with us for as long as possible, I'm not.
Sir, I want to speak.
Yes,
I'm
go
here,
ahead.
sir. I want to speak.
Okay, go ahead, Hafsat.
Sir, my question is about the professionalism, leadership, and research domains. If someone has undergone training under some institutions and gotten certificate under those domains, not from MRT.
Yeah, Hafsat, is it from you or is it from us? Oh, it seems you have even been muted. Can we unmute?
Sir, are you hearing me?
Okay. Yes, I can hear you. Go ahead.
Sir, I said under the professionalism, leadership, and
Yes.
research domains, if
Yes.
someone has a certificate not from MRTB but from a recognized institution, are they going to be accepted?
Of course. I've said it earlier, and I think I said it twice. I said it twice. If it is recognized by MRTB, it will be accepted directly, no problem. But if it is not known to MRTB, then MRTB will ask you to pay for verification, and then will verify that it is acceptable. Who are the resource persons? Who are the organizers? What is the content and mode of delivery? Things like that. When we confirm, we accept it. Yes. So, but
so how
if
can we know that MRTB? Sorry, sir, for
don't
going.
worry.
Okay. How
It's
can we know
just
those that are recognized by MRTB?
Just submit. MRTB will tell you, we recognize this, or write a reply to you to say that we don't recognize it. But at some point, when we have a database, we can release it to say that just check, these are the organizers. But we are just starting to develop the database, so we can't release what has not been developed fully. So at this point, just submit, and then we'll look at it. We'll say, okay, we recognize this, we just issue license. We don't recognize this one. Can you please pay for verification? Give us information about the organizers and things that will help us to be able to do the verification. And then we'll do the verification and we'll clear you. But if we do the verification and we realize that it is not acceptable, then we tell you, bring another one, then you go and get another one to replace it.
Okay, thank you, sir.
You're welcome. Damilola Adebisi.
Hello, sir. Good evening.
Yes,
I
good
hope you're
evening.
doing well. Good evening, everyone. I think it seems like some people have asked diaspora related things, so I won't go into that much. I just wanted to say it's a bit difficult getting responses via email because I tried to explain some peculiarities to practicing in the UK via email, but I didn't get any response. There was a number and I called it. I literally spoke for 2 minutes and spent like 1,000 naira, trying to explain things. I couldn't reach them. Asked if there was a WhatsApp number and I still don't have a response. So it would be really beneficial to have a number to reach because email isn't really working. And then I think just like Ifoma said, we have groups here of like, physiotherapists practicing here. And I think I have your number on WhatsApp. So if you were to make a group or something, we could then like send links out and have people join in. That's at the risk of me raising issues that people might have already raised. And then we can work something out. I'll just ask for maybe a bit of flexibility because like I work shifts. So it's possible that if a meeting is planned, I might not meet that one up. If another is planned, so maybe to have like in sessions. So if people don't meet up one, then they're able to meet up another. And then we can hash out things that are, coming up. Thank you, sir.
That would be fine. That would be fine. Thank you so much. Just please help send message since you have the number. We'll organize something and we'll make it flexible. I wouldn't mind doing it twice or thrice. Let's get the result at the end. Is what matters.
All right, sir. Thank you.
Yes, let's have Ayobami Fashuba.
All right, Prof. Good evening, Prof. Good evening, everyone. Well, firstly, I'd like to appreciate you and the team for the job done and the recent changes we are seeing. I'm coming from the perspective of recommendation, also sharing my views and the way forward. Please, can you hear me? Can I go ahead, please?
Yes, we can hear you. Go ahead. We can hear you.
Okay, all right. The first one is from my own end, is the Abuja training. I think on 2-3 occasions it was postponed. In fact, I think the last message to that effect was sent, I think, few hours before the what's it called? Before the training. And of course, someone like me, I've already planned, I planned my movements. I traveled, so I could not make it. So what am I going to do in that regard? That's one. Then two, well, I know we are trying our best to be better. But however, genuinely, I did not receive any email towards Saturday's training. So what can I do towards that? However, moving forward, how are the ways we can also be of help in making this journey easy for everybody? I mean, both to the team and to we, the registrants. Thank you.
Okay, thank you. Number one, I know it was our fault, the cancellation twice. The first one that was canceled shifted a week, but then we got complaints that people were already on ground and they can't go back and come back again. And not considering others that will prefer not to have it immediately, it was now shifted just to say, okay, let's accommodate those that are on ground. But that's, by the way, you have not attended, right? You have not been able to attend and you want to attend. If you have paid, you have not attended, it's our fault. Just reach out to us. My number is there. Reach out let's see how we can be able to, if it's not more, it's more than one person, 2, 3, even if it is one person, let's just have something for you. I can get someone from amongst the resource persons that we have to do it for you. We'll give you accommodation in our guest house, and if we'll even reimburse your transport fare because you had to go back and then come back again, and that was unnecessary. So just reach out. We'll sort that out. The issue of Saturday's workshop, I'm not sure which of the workshops you are talking about, but I think that platform Mrtb workshop, Mrs. Ile, I can follow that she's always responding. Sometimes Israel also responds. So please just go there. If it is the usual workshops that we have on Saturdays every 2 weeks, they should be able to respond to you. Or possibly you can send an email to cpd@mrtb.gov.ng. But for this particular hands-on workshop that you talked about, you can reach out to me directly and I will guide you on how we can sort it out. Yes, so let's have Joshua or Joe.
Thank you, Prof.
Yes, go ahead.
Okay, so the first thing I want to mention is regarding digitalization of our system, please.
Okay.
recently I was trying to renew my license. I could say I'm up to date at the moment, but while trying to renew it, it took a while before I could even get to be sure that the license had been done. And considering that I had what I wanted to do as regards an appointment with the license, and I had to wait for the paper license before it comes. The question I want to ask is, what is the plan going forward? Are we having plans to probably digitalize the system in such a way that the registrants' names could just be published on the website, and wherever I intend to have an appointment, they could just go on the website to verify if truly I'm a registrant and I'm up to date or not. And Mrtb can also do that. That is my first question. The second question is regarding letter of good standing. While I was trying to renew my license and that for the appointment I was talking about, I was required to submit letter of good standing. And the information I had then was it was only the registrar who could sign letter of good standing. And as at that same time, I also needed letter of good standing from HCPC. And I made a telephone call, and right within 5 minutes, I was told to send an email. And I got the letter of good standing sent to me. Does not require anybody to sign it. As a matter of fact, I was even directed that I could have just gone to the website and get it printed out, provided I do not have any allegations or anything that have been leveled against me. I do not have to wait. And sir, I can tell you that the letter of good standing took more than 3 weeks before I could get it, because we were very busy at that time, and I was even monitoring. Let me put it that way, your journey, because I knew you were going from one inductions to another inductions, and that sort of made it very delayed. I was just lucky to meet up with what I needed it for. So I'm just trying to say, what are your goals regarding this line to make things very easy for the registrants, so that we could have a good time, and then we could get a good system working?
Okay, thank you. Number one, about the issue of digitalization, I think I've mentioned that. The only part that you added that we have not discussed is the issue of having the information about status of the registration of registrants on the website and on the platform. And this is something that we have discussed. The reason why we have not made it active is because of what I said earlier about our records, that we are updating the records. Because it would be a disaster for someone that his employers somewhere will go onto the website and click his registration number, put in his registration number or name, and the name comes up and it says his status is last paid 2021. When he's up to date, that will be a problem to the person. And therefore, before we go to that point of beginning to publish the status of registrants, we need to be very sure and confirm that all our records are up to date before we now get to that point. But we'll get there. But the issue of registration on platform, people have started paying through the platform. What they can do is to upload, and they are working on that. Another thing they can do is we have not created the link for payment for 2 years, because what was there earlier on the platform was 1 year. When we asked the developer, how can you upload? He said, you need to go to AGF office, get approval, go to Remitter, get approval, then send us the approvals. And this is bureaucracy that takes a while. We wrote a long time ago. We are still following up, and we'll get there. So it's a process, but we have started, and we'll continue, and we'll get there. Then the second question about the issue of letter of good standing. HOD is here. There are times that we write the letter, one little difference between that letter and the last one that we wrote, they will write back to us and say that they need verification. Are we the ones that really wrote that letter? Now, because of that, I can now ask someone, my deputy, to sign. The moment it goes, they'll say, last one that came was this person that signed. Why is this one now not that person? So we know they need something to be consistent. And that's why we do that. But we know there are some places that say, just do it, upload and send it, or just an email will surface. We go by the rules of that particular country. So I'm not really sure of your own, but if it is something that is not the same as others that insist it must be a letter and must be signed by that person that has been signing the past ones, just write to us, clarify, so that we'll know when next something like that comes, this is how to handle it for that particular country or organization. Yes. So let's have, okay, that's Joshua, right? That just spoke. Okay, Momelu Solomon. Yes, Solomon, are you there?
Hello. Hello, can you hear me?
Yes, I can hear you. I can hear you.
Good evening. Good evening, Prof.
Yes, good evening.
Thank you very much for this forum. It's quite enlightening and engaging. I can see there are so many. I haven't seen any of my colleagues from P&O making some comment. More or less, more like our big brothers, the physiotherapists. But that having been said, I will need this CPD. Have there been any from P&O? How can we get the people that are qualified to handle this? Because it has been quite some challenge, and I believe we have up and coming new graduates that are coming up, and the licensing is something that everybody needs for you to continue practicing. I just want to know, how have we on our side set up people that can handle this so that we can take off in earnest like other professions in the board? And secondly, the 2-year registration, has it been approved for all the stakeholders in the board? I mean, all the professionals being licensed by the board? And where can we get detailed information on this? Because I tried to access the website, it's somehow not too clear for me. I believe, like you rightly said, gathering information and statistics on this is quite important. But how can we get this clearly so that once I access the website, I can be able to follow up on what I need to do and do it accordingly? That's my question. Thank you.
Okay, wonderful. Thank you very much. Number one, the issue of CPD for P&O. I was in Owerri, and at that time, I had a meeting with 3 people, P&O colleagues with PhD. And we met twice, actually, because I went to Owerri twice. And they came to my hotel. We sat down for more than an hour each of the 2 times that I was there. And we had extensive discussions about how to support the P&O community. And we agreed. In fact, that was when we had an agreement that they should form a group to come up with standards of proficiency for the P&O community, also get resource persons. We discussed a lot and they developed a lot. In fact, it was around that time that I even told them that I need someone that is a P&O a professional in the board. And they gave me a recommendation, and that was how Victoria came to be a staff of Mrtb. And she is the one that has been liaising between the board and the association and other professionals. And so the last time we met, we had an agreement with them that let the workshop, hands-on workshop that will take place for P&O, take place during the conference of P&O. We wanted to organize others, but we had an understanding because of the number of resource persons available and the locations and other things. Agreed. But as I've said, for all professions, I've said this to occupational therapists. If there are individuals that don't want to wait for Mrtb or the association to organize workshops, let them put themselves together in as much as they have up to 10. But for professions like occupational therapy, P&O, that don't have too many, even if you have 5, reach out to the board or reach out to the association, whichever one you are more comfortable with. We'll organize, we'll send a resource person, and we'll support you to be able to have the CPD. Remember, it's not about license renewal primarily. It is about advancing our practice, but of course, secondary matter comes up, which is the CPD. Thank you. So let's have Sunday Ayeno Wowan. Sorry if I pronounce it wrongly. Yes, Mr. Sunday, I've asked you to unmute.
Okay, thank you, sir. I want to really appreciate Professor Rufai for this educative platform, and I actually enjoy the contributions, questions which other participants have actually asked, and how you are able to explain the details, even those in diaspora. This is a welcome development. However, there are some certain observations that I have. New development. Somebody asked about how concerning the add-on skill, add-on acquisition, as regards to those domains that which has been spread out, that they show interest or probably they have registered, and the process probably they did not meet up to it. You can organize how that add-ons can be, or the add-ons can be established for them, organized for them, and by then you can sponsor them to come back to Abuja or whatever to have the workshop done and then issue whatever certificates. But my challenge is, I don't know if there's any provisions that you have created, because there are some individuals, even when they have interests in their place of practice, their management may not actually release them on time, or probably release them because of one shortage of staff or the other. So, and again, traveling from their primary assignment to a location just to go and receive, a workshop for hand-on skill in order to meet up to the requirement of that domain. I want the board to look at it very critically. It is a laudable development. There's no doubt in that. But let's see how these can actually synchronize together to ensure that an individual domain where they are practicing and where they are not going to leave to another location to go and acquire an add-on skill just because the number required for them to actually, if possible, they want to do it in their domain is not enough. And because of that, they could not be given that, that privilege until they travel elsewhere. I just want to suggest that let the board look at that aspect and see how they can make it a little bit more easier, because it's new. Over time, it's going to evolve. The evolvement of this program will definitely bring about kind of sustainabilities and how we can keep on moving forward. But then the stringent rules we for the teeth period, we just have to look at it in such a way that it does not create some rankles or probably cause some problems to some registrants just because of this platform. The second aspect, I just want to chip in, sir, please, if you can pardon me, is the issue of how the board can ensure that in each state, if possible, to ensure that, because the 36 states, including Federal Capital Territory Abuja, should equally have centers where, the stakeholders and individuals that will be taking the participants, the various workshops, which are going to be established. I'm of the opinion that each state should have an established center. And if possible, in a state, we can have 3, 4 different centers where that can be the proximity of participants or registrants will be able to have access, easy access to those centers. These are my just candid suggestions. And again, as a person, somebody has actually raised this question as regards that he paid for 2 years. But when you look at the earlier release about the formats, I think, if I'm not mistaken, I saw a clause from the earlier release about other 2 years registration, 1 year registration, and all that, and the required CPDs. Now, when you look at this, there was a clause that before 15th of December, that everyone should have actually paid for their renewals of license, probably against 1 year or 2 years, as the case may be. Now, so that the board is going to collate and forward and publish to the registrar, so that in their various establishments, the document will be forwarded to their management in order to ascertain that these will be other duly registered. That was the earlier information. But from this platform, it shows that actually is not going to, have ground to be established in a form. I don't know what could have been actually changed, because some people have actually paid for 2 years. Whereas, like person like me, I've paid for 2 years. But what I'm getting here now is that those who have not been able to do the hands-ons, I've actually got up to 45 points of my CPDs or whatever. But I even did a leadership training, which was just recently organized by Ray Institute. But I forwarded it, even up to now, I've not received any information from the board. That is one. These are itches, but I want the board to look at it holistically and see how convenient, how the board is championing, the development of every professional practice, or that is the board covers, so that every registrant will be able to have, their way forward and act to equally make this platform, a robust to develop themselves. It's a laudable development. I've been participating in the Ray Institute most regularly since right from August. Even up to date, I don't think there's any month I've ever opted from their workshop. But then I've not been able to, the issue of this household, I have not been able to have privilege. I intend to register for that Ondo center. But when I look at it, discover that I may not be released even from my own center, even though I was even on leave. I had intention to go, but there's another program of mine that actually, prevents me, which I was trying to really, I suppose. I just want you to look at it holistically and see, is it a welcome development, or let's see how it's not going to place a bottleneck for registrar even at their place of primary assignment or their workplace, so that they can have easy access to do some of this workshop. These are my submissions. Thank you.
Thank you very much. Actually, when we released the issue of having CPDs, we mentioned that people can organize training from amongst themselves in their departments, in their states, in their groups. They can organize workshops. The only thing is that make sure you have someone as a facilitator that will give what is required for people to get as knowledge and skill. That's allowed. And even now, that is very okay. Every department, they have a senior person that, or someone that has had the training and the capacity to give training. They can do that. Now, this particular hands-on training that we have just had is a different issue. There is this rehabilitation competency framework. These are documents of the Rehabilitation 2030 agenda, they developed what is called the rehabilitation domains. And they now want to see how we can be able to expand the practice by looking at the domains and across ICF. And it's not something that many professionals across the country practice. It's something they developed, which is very good. And therefore, when we got someone that was part of the team that developed these documents, we said, let's have train the trainers. We invited about 20 people, two from each zone, and we added few, and we met in the board for 3 days. We had trained the trainers. Because there are not many, we did it free. They only paid for their transport. We gave them accommodation. We did the workshop free. The board took care of all that. And then we said, okay, let's now extend the trainers. If we do these workshops across zones, whoever attend is on our record. From whatever state they come, they are now going to serve as the resource person to now cascade that to their own states. And this is the next stage that we are aiming for. So whatever it is that is available across states, states are allowed to organize and do their CPDs. But whatever it is that comes in new that we want to do, then we'll start with train the trainers few from regions, then we'll have regional workshops, and then from the regions, we'll now move it to states. So I agree with you, what you have said, and we are going to work towards that. But for those things that come new, that we don't have the skills and the knowledge across the country, then we'll now begin with having this train the trainers, and then we'll cascade it. It now goes down. What is in the circular is the same thing. Maybe I just confused things in my explanation. 15th is the date of payment. 31st is the date of having certificate or license issued. So what we are just saying is that if you pay on the 15th, you have 2 weeks for the certificate to be processed, and then it will be issued on the 31st. But if you are paying on the 31st, then you will need 2 weeks into January to process an issue. And if you don't have that 45 CPD units that you're talking about by the 15th, but you have made payment, you quickly get it. We'll still process, and by 31st, you'll be able to get your license. So, of course, by next year, things will be different. We have already informed people over 2 years will be more rigid next year. But this year, just like we did last year, when we see things getting towards the end of the year, people have made efforts, and there's still 1 or 2 things, we'll overlook some things and move forward. But by the time we get to next year, then we just have to be as rigid as possible, because 2 years is enough for people to get reoriented with the new system of doing things in the board. Thank you. Someone mentioned that we should postpone and maybe try another time. What do you think? I can still see about 14 people raising hands. It's already 10:51. As I've said earlier, I can stay as long as possible. I'm just asking HOD, let him go. I can stay, but I don't know what you feel. Please just let me know, even if it is through the chat forum. Should we stop, or those that raise hands still want to wait and we continue, so that others that have not raised hands that want to leave can leave? Please just let me know what's the general consensus. Kindly postpone. Okay. Oh, let's continue. Okay. Postpone. Let's continue tomorrow. I suggest we stop at this. Wonderful. Okay. Kindly postpone. So thank you so much, everyone. Really enjoyed the session because we have gotten a lot of feedback, and I assure you that we are going to do better. In fact, by next week, I pray and hope that what we are planning to do between tomorrow and next tomorrow is going to make an impact, that at least all these suggestions that have been raised will be accommodated. Thank you so much. May God bless you. Bye-bye.